my health records uploaded to the electronic health record sharing system, will others be able to view them without my notice? Will there be no privacy at all? Don't worry. To safeguard patients' privacy, EHRSS stipulates that even if healthcare providers have participated in EHRSS, they are required to obtain sharing consent from patients before they are allowed to view and upload patients' health records. By giving sharing consent, patients authorize their healthcare providers to view and upload their health records. There are two types of sharing consent: indefinite sharing consent and 1-year sharing consent. So, how do I give sharing consent? After registering in EHRSS, you can give your sharing consent by inserting your Hong Kong identity card into the card reader designated for EHRSS when you visit a participating healthcare provider for consultation, or you may sign a consent form and return it to your healthcare provider. You can also use an access key to give your sharing consent. What is an access key? Upon successful registration in EHRSS, you will receive an access key through your selected communication means, such as SMS, email, or postal mail. When you visit a registered healthcare provider for consultation, you can provide this access key to give your sharing consent after your identity has been verified. By doing so, it means that you have authorized the healthcare provider to view and upload your health records. With your sharing consent, the healthcare provider can access your records by just inputting your identity card number into the system within the valid sharing consent period. Besides visiting a clinic to give my sharing consent, are there any other more direct ways of doing it? To save time, you may consider using our Consent Anywhere feature. Can consent be given anywhere? Of course, it is simple indeed. Firstly, access the EHRSS website to check whether the hospitals and clinics you visit have already joined EHRSS. If so, you may visit your designated registration centers to register in EHRSS and give your sharing consent to these hospitals and clinics at the same time. You may also give sharing consent via the 24-hour interactive voice response system of the EHRSS hotline, or call the participating healthcare providers you are about to visit for consultation to give your sharing consent. Then, when you make an appointment or visit the clinic for consultation, you can inform the doctor direct that you have already authorized him or her to access your records. Thus, you don't need to wait until you visit the clinic to give sharing consent. Aside from saving your time, your healthcare providers will also be able to view your record in advance, which helps enhance healthcare quality and efficiency. I'll also receive a confirmation notification of the sharing consent given through my selected communication means. In this way, I'll have complete control over how and when I give my sharing consent. Subsequently, whenever you visit this clinic for consultation, its healthcare staff will only need to input your identity card number into the system to access and view your health record. And you'll receive notification upon each access to your record, so you don't have to worry your records will be accessed by others without your notice, as your privacy is well protected. What if I've forgotten my access key, since it is so important? No worries again. Just call the EHRSS hotline and you will be able to regenerate a new access key through the IVRS. Alternatively, if you plan to give sharing consent to another participating healthcare provider, tell them that you've forgotten your access key. They will help you regenerate a new one through EHRSS, which will be sent to you through your selected communication means. Once it is completed, your old access key will become invalid. But don't worry, it will not affect the sharing consent you have previously given to other healthcare providers, so be assured of its safety and convenience.